rotate the upper body just to give the patient a good solid base so they're not feeling like they're too tippy on the table. And then that will allow me, with regards to the lumbar spine, to rotate the upper body pretty easily. He's all the way at that side of the table. I got to get him to scoot, so I'm going to ask him to scoot, and I'm going to help him. So scoot towards me. There you go, just like that. Once we're here, now he's kind of on the edge of the table, so now I make sure that the patient feels safe. Now this is the exact same process that I would use for any of the lumbar setups and pretty much all of the pelvic setups. So we're at baseline, side posture. Now we can talk specifically about the push-pull. And again, really, any of the lumbars, the first thing we're going to do is decide what segment we need, and we've decided that as a result of the assessment procedures, the motion palpation, whether we're doing it prone or seated. And I take 2 SPs. So right here, this is L4, this is L3. I'm palpating L3, 4 like that. And I flex the hip until I feel L3 and 4 move apart like that. And that's where I keep this. So this knee is keeping that leg there. If I let it go, I've just let go of that tension that I've developed. So this knee keeps that there. Then I take the upper body and I rotate back until I feel the SP of L3 drop down like that. And then I know that I'm developing tension right at that joint. So I'm doing the push-pull. So I'm going to put the downside hand in the armpit like that, upside hand like this. Now I feel like your arms are heavy enough to where this is giving me some feedback. If for some reason your shoulders were totally floppy and you just relaxed and this arm kind of went back there, I would tell you just to very lightly hold on to that arm. Some people will teach you that they want the patient to clamp down. I don't like that idea. It's a good idea because that actually gives you a little bit more control of the patient, but if they clamp down hard enough, they're going to contract their abs. And then it's going to be really hard to actually twist them into this position and really kind of negate this whole thing that we're doing. So, yeah, you don't necessarily have to. I feel like I got plenty of feedback there from your arm. So, I'm still on these 2 SPs here. I make sure that I rotate the upper body. Notice how I'm doing that. It's my elbow kind of towards the deltoid, like I'm trying to bring my elbow behind his ear. And I make sure that I get that top SP to move a little bit, and I keep that there. At this point, I should have about 50% lower body rotation, 50% upper. If the upper body's rotated too far, it's going to put me in an awkward position. If the lower body's rotated too far, his leg's already pinned on the table, and now I can't actually do anything with this leg other than hurt him. So, about 50% upper, 50% lower body. And then, let's say he had really flexible low back, and I took my knee off of this, and his leg just flopped to the ground. I'd want to control this before I put this knee on his knee. And I'm going to control this with my forearm here, keeping his pelvis like that, and then also sliding my knee up until I hook it right into the space behind his knee, just like that. And now I got control of this lower body here. So now what I do is I finish up the final tension by pulling the lower body and pushing on the upper body. Again, trying to make this 50-50. So I get here. If I just do one or the other, I'm completely unbalanced and possibly slamming his leg into the table. I don't want that to happen. So I find that first barrier and bring this tension right there. We got a little bit of tension. So now what do I ask him to do?
Take a breath.
Take a breath, yeah. Breathing's good. But now what? Yeah, don't let me move you anymore, or try to untwist yourself. So go ahead and don't let me twist you anymore. I'm going to try to twist you. Don't let me do that. That works. You just got to do it slowly because it's kind of complex. So we hold that for 6, 8 seconds or so. Go ahead and relax. And then both knee and upper body increases that tension. So notice where I'm here the whole time. I'm not out here. I'm not just doing this part of his body. So I'm here doing this. So there's a little bit of coordination. Standing on one leg to do that. Want to see that again? But also, my body is centered over his body, and I'm compact. So I'm not hurting myself. I can use my body weight to resist whatever torque he's creating, and then I can get a little bit more tension just by using my body weight, so I'm not overextending myself. If I were going to turn this into a grade 5 manipulation, that would be incredibly important. So when we get to the the kick and pull, and also the drop with the hypothenar mammillary push, those types of ideas are going to be incredibly important. We got to get our center of gravity in the right spot, or we could potentially be hurting ourselves. So let's practice this. Find that tension. Make sure it's not this kind of tension where the patient's like, oh yeah, that's tension. It should be like, oh yeah, I feel that a little bit. That's the perfect amount of tension to start at, and then we increase it incrementally.